We begin with developing news. Evacuation efforts in Afghanistan rocked this morning by at least 2 explosions in what U.S. officials are calling a suicide attack. Isabel Rosales is live with the latest.
Today marks the 3rd deadliest day for U.S. servicemen in Afghanistan. We just heard President Biden speak there. He called them heroes and the backbone of America. And to the terrorists, he said, quote, "We will not forgive. We will not forget. We will hunt you down and make you pay."
We're outraged as well as heartbroken.
Disturbing images of people crying for help outside Kabul's airport in the aftermath of at least 2 confirmed blasts.
An attack by a group known as ISIS-K took the lives of American service members standing guard at the airport and wounded several others seriously.
Chaos nearby as the explosions sent crowds running. U.S. officials warned of an increased threat level in the hours leading up to the attack.
The word has gone out to individuals, Americans, green card holders, and some others, telling them to stay away from certain specific gates. So that sounds like a specific threat to me.
One explosion took place at a hotel near the airport. Another at the Abbey Gate entrance, where Afghans have gathered for the last 2 weeks, desperate to escape the Taliban-controlled nation.
It's going to be tough getting more evacuees in. We're probably going to see an increased reduction in the numbers that are getting out of Afghanistan.
The U.S. military and NATO have already evacuated thousands of U.S. citizens and vulnerable Afghans. Those efforts are set to wind down ahead of the August 31st deadline for the final exit from the 20-year war in Afghanistan.
To those who carried out this attack, we will not forgive. We will not forget. We will hunt you down. Operator.
Yeah, and President Biden revealed that he has ordered plans to strike back at ISIS-K. But he says that we will not be intimidated nor deterred by terrorists. The mission of evacuations continue. And at this moment, we know that there's about 1,000 Americans still in the country. Live in Washington, I'm Isabel Rosales.
Thank you for that report, Isabel. Let's get you those latest coronavirus numbers now. The state health department is reporting 831 new COVID cases today. The breakdown by island includes 176 cases on the Big Island, 32 on Kauai, 1 on Lanai, Molokai with 2, Maui 102, Oahu reporting 511 cases and 7 people diagnosed out of state. 37 more people are hospitalized with COVID. And Vice President Kamala Harris is expected to visit Oahu today on her way back from Southeast Asia as part of the Biden administration's efforts to counter Chinese influence in the region. During her visit here, Harris is set to meet with service members at Joint Base Pearl Harbor-Hickam in the afternoon. She will then meet up with her husband, who is on his way back from the Tokyo Paralympics. Now, their stop on the island will be short as they are scheduled to leave later in the day.
All right, we got some live news coming into the H&N Digital Center. Take a look at this happening downtown. This is a press conference unfolding right now with Native Hawaiian leaders speaking about the surge of COVID in the community. I want to let us listen in.
Our first speaker this morning, Diane Paloma from Nunalilo Homes.
Aloha e na oiwi, aloha. O wau o kauka Diane Paloma, mai nā kupuna, I ka home o Lunalilo, I ka malu o Maunalua o Ahu. Aloha, I'm Dr. Diane Paloma, the CEO of Lunalilo Home. I bring good tidings, good wishes, and ola and health from the kupuna of Lunalilo Home in Maunalua o Ahu. Hawaiians have a olelo no'eau. Ilohe ka olelo a ho'oko, e ola aua ne'i a laupa'i. One who hears good counsel and heeds it will live to see many descendants. And today, I received good counsel to continue to wear my mask, to avoid large gatherings, and to get vaccinated to reduce the spread of COVID-19 in our communities. The consequences of this pandemic are devastating, and we must take action now to protect our future. It is my sincere hope that the generations that come long after us know that we did everything possible to remain standing as a lahui. I am here today because I want them to thrive. And this is why we are here today, so that we thrive. In 1859, the Queen's Hospital was created for our lahui. But even after the hospital was established, Queen Emma still suffered tremendous loss, losing 8 of her immediate and extended family members in about a year's time, including cousins, her mother, her son, and her husband. In 1881, Queen Liliuokalani, whose statue we stand in front of today, ordered the measure of Oahu commerce to cease during a smallpox epidemic. At that time, we lost 10% of our native Hawaiian population. I'm not even willing to lose 1% of our lahui. Our ali'i had to make these strong and difficult decisions, and did so with the intent of the lahui and for those who come after us. It is unfathomable for me to think of which 8 of my immediate and extended family members I am willing to lose in the next couple of years. In 1883, Lunalilo Home was established as one of the first ali'i trusts. Our ali'i bequeathed their wealth to the people. No other monarchs in the world have done that, leaving their own personal wealth to the lahui. The gifts and the legacies that our ali'i have left us have helped to uplift our lahui in so many ways more than they could have probably ever imagined. And now it is our chance to malama that and to ensure a bright future for those who come centuries after us. That is why we're taking no chances at Lunalilo Home with this new Delta variant, and our organization, I'm proud to say, is 100% vaccinated in terms of staff and 100% vaccinated for our kupuna. I'm proud to uplift the mission of our ancestors to care for, to protect, and tend to the well-being of our kupuna, those who hold the insight, the knowledge, and the lived experiences of our people, our elders. For it is their pathways that we follow. So let us pave the way for our own descendants as we step into those roles of makua and kupuna, whether we like it or not, and that they may benefit from the decisions that we make today to protect the health and well-being of our lahui. Eola kalahui. I'd like to introduce the next speaker, Dr. Kalehua Krug, a community and resident member of Waianae and the principal of Kawhaihona o Ka'ana'awau Public Charter School. Aloha.
Aloha mai ko Hawaii kanaka. Our community is in a crossroads. One road is guided by our negative perspective and experiences and the distrust of science and scientists and government and big pharmaceutical companies. The other road is guided by healthcare and current mainstream medical information. Both roads have valid concerns and are so deep and fraught with nooks and crannies. This has certainly become a well-constructed maze for many to get lost in. When we are fearful and lost, we hesitate. For many, as we hesitate, inaction becomes our action. And for some, inaction has a grave outcome. The action that I'm asking for is not just a message of vaccination, but one of action. The vaccines are one of the ways by which we can help battle through symptoms and long-term effects of this virus, both young and old. We all know how to kokua, and it means keeping your mask on, staying home with the ohana, and listening to your healthcare providers. They have gone through years of training to be there for us right now, and they have risen to the occasion, and we must rise with them. I personally choose current science because our people were innovative and utilized many principles of science to build our indigenous world. As stated in the discussions on the Mauna, we are not against science. With that said, the most current science tells us that the vaccines help ease the symptoms, especially for our elders, the important elders, and those that are health compromised. I acknowledge the truth that I am fearful of what is to come. both from the vaccine and the virus. But the statistical percentages of mainstream survivability and long-term effects may not hold true for our lahui. We don't normally reflect mainstream statistics or data. Are we sure that 99% of us will make it out? As an educator, I also worry that the residue of our current situation will negatively affect the hearts and minds of our haumana and our keiki. Please do not breed distrust for our healthcare workers and the medical field in our communities. Don't place doubt in their hearts and minds, in the hearts and minds of our children, for those that are ready to save our lives. As a teacher and now the principal of a Hawaiian-focused charter school in Anakuli, we encourage our students to embrace education as important. We have guided them to kulia and become doctors, nurses, and lawyers and such, if they choose. And in this context, after all of our encouragement and all of their hard work to get there, we seemingly have turned our backs on our native Hawaiian doctors. Please find them in your communities and raise them up as your leaders. Let their knowledge and experience guide us in troubled times. This context is also teaching our keiki to look to the internet before leaning in on our true experts. Our Kanaka doctors and our nurses for information and guidance. They are our modern day healers. And sometimes you need foreign medicines to heal foreign illnesses. The idea of truth is important because when no truth can be found, we will spin into chaos, confusion, and ultimately conflict. I myself strive to be a man of action, and we are a people of action. I urge us all to use every tool we have and exhaust every possibility there is to fix this collective problem and save lives, even if just one. A balanced approach has always been and is the best path to save lives, and after all that our people have historically struggled through dealing with foreign disease. No more lives are worth losing, especially those of our lahui. Mahalo. I'll pass this on now to Dr.
All right, that was a press conference down at the state capitol unfolding right now. Our Rick Daysog is there as well, and we'll have a complete wrap-up of everything that is unfolding there right now at this hour, coming up on later editions of H&N. Want to turn to some other news. You know, there was another night of protest outside of Lieutenant Governor Josh Green's condo downtown. He's saying he's pretty much had enough of this harassment and said sometimes it's crossing the line. Ben Gutierrez has much more on that.
The lieutenant governor says the threats have escalated in recent weeks, where now he's being pursued by people demanding to talk to him and recording him in what he says are private settings.
I absolutely support people's rights to freedom of speech and to gather. However, if they follow me and make death threats and film me through windows, I think we'll leave that to other people to judge.
That's right, death threats. And here's one of the posters with racist writings posted outside Dr. Green's downtown condo.
So it gives you an idea who they are, what they're like as people.
Hey, Josh Green.
Some commentators on social media pages have made threats while sharing videos of Green.
You don't want to talk to your constituents?
Here's one of the latest making the rounds, with an activist following him to his car, yelling questions at him as he heads home.
When one is going home after having dinner and people are threatening you, of course that's not the time to talk to them.
And when he gets home, protesters are often there to greet him.
You have individuals yelling hate speech toward me, shining lights into my apartment and the apartments around me, my neighbors.
There's another video circulating online with critics saying they busted Green without a mask at a restaurant Tuesday night. He says it was a campaign dinner following the governor's mandate on limiting gatherings to 10 people indoors.
I had a private dinner for a total of 10 people, including myself. And again, they were all vaccinated. But unfortunately, people right now are following me everywhere I go.
Green, who says he's been working 18-hour days lately, is getting fed up with the harassment.
I know that there are going to be people who are attacking me because they're very anti-vaccination or they don't appreciate having to wear masks. But I'm going to keep doing my job as Lieutenant Governor, and I will also make sure I follow the rules.
Ben Gutierrez, Hawaii News Now.
And the lieutenant governor says the threats are being turned over to law enforcement for further investigation. We are awaiting comment from the Aloha Freedom Coalition, which has been protesting the state's anti-COVID mandates. We want to take you live now to the Big Island for a look at the summit of Kilauea. This is an updated image from the webcam there. It has seen hundreds of earthquakes this week, but activity seems to be calming down. The Hawaiian Volcano Observatory is lowering the volcano alert level from orange to yellow, reflecting this decline in activity. Ken Hahn, the scientist in charge there, gave us an update today on Sunrise.
Well, it appears like this event is over and there does not appear to be an eruption associated with this movement of magma.
Okay, so what do these earthquakes mean then that we've seen this week?
Well, when we see a cluster, this is a very tight cluster of earthquakes at very shallow levels, like a half a mile down or so beneath the caldera in Kilauea. And it was accompanied by a strong change in the shape or uplift of the ground in that area as well. And so what that shows us is that magma has moved up in a series of cracks and was moving towards the surface and filling an area. We generally call these things dikes, but it's an intrusive event where you're injecting liquid into the rocks above the main magma chamber.
And while that sounds disturbing, it's actually just contained within that crater area where we have seen magma bubbling and it doesn't really affect anyone, right?
Right, and this was a little bit outside of the new Halima'u crater, but it would have still been within Kilauea caldera. There's a chance it could have gone southwest, but there's nothing out there except for the national park. So this eruption would have been completely, if there would have been an eruption related to this, it would have been completely contained within the national park and nowhere near any roads.
How much better are you guys at predicting a huge event like the one we saw in 2018? I mean, that almost seemed to come out of nowhere.
Well, it did and it didn't. I mean, we can only see what the volcano lets us see. Right. So when we're really looking with seismometers, we're feeling, listening to vibrations in the earth. And until the magma starts to move, we don't know what's really going on. So, we knew that there was a possibility of something like the 2018 eruption happening. But until the magma makes a move, we don't know. And so, we had several days of earthquakes and activity that showed us magma was moving down into that region in 2018. And that's really as good as we're going to get with a lot of those things, because until the magma makes a move, we can't track it.
So how likely is it that we would see another eruption like the big one we saw in 2018?
Well, it's less likely after having one of those, but in 1955 and 1960, we had a pair of eruptions down there. 1955, right in the same area that the 2018 eruption is. And 1960 was the area that took out Kapoho. So it's possible, but we will see earthquakes in that region. And right now, that region, the entire rift zone that feeds out to there is very quiet. So all of the activity we've seen in the last year has been focused on the summit or very close to the summit.
So overall on Hawaii Island, should we be concerned about anything, or does it seem pretty stable as far as volcanic activity is concerned?
Well, at the moment, we're back to being pretty stable. Kilauea is sort of repressurizing after that 2018 event. And so the activity is kind of around the summit where the main magma chamber is, kind of inflating or pushing that up. Mauna Loa seems to be a little bit quieter now. So we're not really looking at anything imminent.
All right, let's take you live outside because we also want to talk about the weather today at noon. Let's turn it over to Billy V with more on that.
Thank you very much. Happy Aloha Thursday. Let's give you your forecast. First of all, let's talk about the red flag warning that is in effect for the leeward sides of all Hawaiian Islands. According to the National Weather Service, there's a combination of weather conditions, strong winds, low relative humidity, warm temperatures that created critical fire weather conditions. According to one forecaster from the National Weather Service, it says that if a fire gets out of control, it can spread quickly because of these conditions, and that's for all the areas that you see highlighted here. Small craft advisories are in effect for these Hawaiian waters highlighted, and that's due to the strong and gusty trade winds. So use some caution if you're going out onto the open ocean. In the meantime, we're seeing some east-facing shore surf, 2 to 4 foot waves. That's a trade wind swell, 1 to 3 on the south-facing shores, with more waves to come this weekend. Not a whole lot of precipitation, just mostly windward and Mauka showers drifting leeward at times. And here's your 7-day forecast for you. It's going to be gusty trades today, northeasterly winds 15 to 20 miles per hour, daytime high near 89, and it's pretty much trade wind weather Thursday, Friday, Saturday, lighter trade wind weather into next week. As always, get the latest on air, online, on your mobile device, and at hawaiinewsnow.com.
Thank you so much, Billy. Time for some good news. So this week, the Aloha United Way is launching its workplace campaign, giving at more than 1,000 workplaces in Hawaii. Now, the funds will help more than 300 local nonprofits that do so much for our communities, including the Waikiki Community Center. So for more on how this campaign works, let's send it over to the center's president, Caroline Hayashi.
Waikiki Community Center has really seen such a great amount of support from the Aloha United Way Workplace Giving campaign. Our mission is to care for our kupuna, keiki, and community as ohana. The funding really allowed us to respond with flexibility during the pandemic. You know, things were changing so rapidly. A lot of times with the traditional grant model is you apply for a project and there's a kind of a long timeline. And so you can't necessarily pivot very quickly, but funds through Aloha United Way's workplace campaign gives us that flexible funding to really pivot and meet the needs. Like, for example, our emergency food pantry demand has increased over 400%. And, you know, many families that had never received food through a food pantry have now been in the position where they need to do so. And so those funds, for example, and other funds we've collected through the community have really allowed us to provide that support and make sure that we have what we need to support people in the way they need to be supported.
You know, the Waikiki Community Center is not only a beneficiary of this campaign, but you are one of the more than 1,000 workplaces that elect to give to Aloha United Way. Talk about how that side of the program works and why you guys choose to do that.
We wanted to also give back. So we have a belief, we call it Give Aloha, Get Aloha. And our belief with ourselves, as well as all our clients, is that everybody needs help sometimes and everybody is capable of giving sometimes. I've seen so many examples of people with actually very little in terms of resources, some of our clients, giving back in really generous ways of their time and even of their funds, what little they have. And what I found is that's extremely empowering to know that you're not always on the receiving end, but you're also able to give back and help others. That makes people feel good. For that reason, you know, we as a staff really like to participate in the campaign ourselves.
So if there is a business or a nonprofit out there that's watching this and they're like, hey, we want to get involved and help too, what's the easiest thing they can do to sign up?
They can go to the Aloha United Way website, and it's easy to start a workplace campaign. Just go to auw.org/together. We send out and communicate to our employees that we really have the goal of having 100% participation. So you can give a one-time gift. You can have it monthly deducted from your paycheck. So there's a lot of different options that really allows flexibility so anyone can really join in.
What a great cause there, Ashley.
Mm-hmm.
All right, guys, that's going to do it for This Is Now on this Thursday. We have so much more news to get to later in the afternoon. Don't miss First at 4 on KHNL. And don't forget, we're podcasting all the time. Search for Hawaii News Now anywhere you find your podcast. Have a great one.